Statistics show that 2.4 million Filipinos suffer from glaucoma, one of the leading causes of blindness in our country. But why are people with this disease not aware that they're already suffering from it? And why is it called the silent thief of the sight? Join me as we answer these questions with our guest doctor. I am Kristianne, your host, and this is Health Watch. To better understand glaucoma, we are delighted to have with us our guest ophthalmologist, Dr. Karen Francia. Good morning, Doc.
Hello.
And thank you for being with us again.
Good morning.
So, to start with our topic, can you tell us how glaucoma causes blindness?
Okay, so glaucoma, when you talk of glaucoma, it's actually a nerve disease. It's a disease of the nerve of the eye. It's so we call that an optic nerve disease or optic neuropathy, in which the pressure inside the eye increases, and when the pressure inside the eye increases, the nerve becomes compressed or damaged, and then it's the visual field of the patient that becomes compromised. For us to understand that better, actually, I want to show you first the inside of the eye and how the fluid flows inside the eye. Okay, so this is our whole eyeball. If we slice it open, here, okay, there's a chamber here. Okay, so the space between this and the iris is the chamber, and there in the corner, that's where the fluid of the eye drains. Okay, so there's normal fluid inside the eye. It's called aqueous humor. There's constant secretion of this so that it's always new. Okay, so the amount of aqueous going inside the eye is balanced by the amount of aqueous fluid exiting the eye. So that will give you a constant pressure inside the eye. Okay, like the wheels of, like the tires in your car. Okay, so there has to be an optimum pressure. It can't be too soft, it can't be too hard. Okay, so the same thing with the pressure inside the eye. However, when we get older, for example, the drainage system here can become damaged. So if it becomes damaged, pressure slowly builds up inside the eye. So the pressure, for example, is normally between 10 to 20, but if there's damage in the drainage system, this will slowly creep up maybe to 22, and then 28, and then 30, 35. This happens very, very gradually over many, many years, maybe 5 to 10 years. So this slow build-up of pressure inside the eye, okay, compresses the nerve. This is the optic nerve. So when the nerve becomes compressed for a long time, that's when the vision starts to blur.
So what are the signs and symptoms of glaucoma, and why is it called the silent thief of the sight?
Okay, the symptoms are actually very subtle. For the most common type, which we call open-angle glaucoma, there are actually no symptoms. That's why it's called silent thief of sight. Okay, because the damage occurs very, very slowly, and the blur starts from the periphery. We mean the visual field. For example, when we're looking at each other, we look at each other's face, right? But you're also aware that there's a wall here, and you're also aware that there's another person there. That's our peripheral field. Okay, but looking at you, I'm using my central vision. Glaucoma damages the peripheral field first, what's out here. And since the field becomes damaged, meaning it becomes smaller and smaller, very, very slowly over many years, that's why patients don't notice it. It's like a thief stealing from a big bodega of rice, and then he steals only one sack of rice every day. So if the owner doesn't check every day, he will not really notice now out of the thousands of sacks in the bodega that one is missing, right? So it's like that.
So does the person actually experience any pains?
For the open-angle type, the one I described to you just now, since the pressure inside the eye builds up very, very slowly over many, many years, there's no pain. The reason there's no pain is that the eye has had time to become accustomed to the rising pressure. Since the pressure goes up very gradually, they don't feel pain actually. Even as the visual field slowly becomes smaller, they don't feel pain. However, the only time glaucoma causes pain is if the pressure rises suddenly. That's another type of glaucoma called an acute angle closure glaucoma.
So it's more severe?
It's more severe in the sense that the patient experiences severe pain. The classic presentation of acute angle closure glaucoma is a triad of pain, eye pain, severe eye pain, blurring of vision, and eye redness. Okay, sometimes it's so painful that they start vomiting, they have a bad headache, they go to the emergency room.
Alright, thank you, Doc. So up next, we will discuss how a person can be at risk of glaucoma. So stay tuned, Health Watch will return. So Doc, who are usually affected with glaucoma?
Glaucoma is actually mainly affects elderly people.
So Doc, is there anything that we need to avoid? So aside from diabetes, are there any other diseases that can increase the chance of getting glaucoma? And we're back here on Health Watch with our topic glaucoma, and together with our guest ophthalmologist, Dr. Karen. So Doc, who are usually affected with glaucoma?
Glaucoma is actually mainly affects elderly people. You may, for example, inherit the risk to have glaucoma, but it tends to present itself later in life. For example, 60 and up, 70 and up, 80 and up. What we mean is that the older you get, the higher the possibility that glaucoma may develop. If we look at the younger age group, these are the people who usually develop the angle closure type. Because the angle closure type, the one we mentioned earlier, the one that's painful, because that depends more on a very small anterior chamber anatomy. For example, you're really born with just a relatively small eye compared to other people. That means everything else is packed together. So there's a higher tendency for the angle here to close. So for those people, sometimes we see them in their 40s, 50s, they get an attack, and then you need to do a laser. But for the open angle type, in general, it occurs in older people, 60 and up. That's why we do recommend that once they reach the senior citizen mark, that they have at least a baseline eye examination.
So to those who have inherited glaucoma, at what age does it usually start?
It depends what kind of glaucoma their parents or their first degree relative had. If it's the open angle type, then most likely they will also inherit the same similar type, which is the open type. But if, for example, their family member, their mom or their dad or their brother or sister developed an acute attack, for example, if they developed it at 40, then it would be nice also to have an exam at 40 or 45, something like that. But there are no hard and fast rules actually. So it's just screening, going to their regular eye exams for their doctor.
Well, speaking of exams, what are the available tests to detect glaucoma?
Well, the simplest one is the ophthalmoscope. Okay, this is a very basic instrument. Actually, pediatricians also use this. Your ear doctor will have a similar one called an otoscope. Okay, except that the top is different. This is an ophthalmoscope. So this is the simplest way to screen. The doctor looks inside your eye and will be able to see your nerve. If the optic nerve appears deep, then the doctor might request for additional tests. Okay, so the first test would be to take the intraocular pressure with a machine like this. This is called a slit lamp, and there's a little instrument attached to it with this. This is called a tonometer. So this measures, this instrument here will touch the cornea and measure the intraocular pressure. So pressure should be between 10 to 20 millimeters of mercury. If it's over that, then the doctor might send the patient for a visual field test. This test is available here at Tony Chan Eye Center in Doctor's Hospital, and the result will be So it looks something like this. This is an abnormal test showing the black area is the constricted visual field, meaning there's already been damage to the visual field. A normal visual field will will have less of the black areas around it. So something like this, or something like this. Okay, so this means that the patient can still see a whole lot wide visual field compared to this one that looks mostly black. This one looks mostly black on the sides, and then there's just a little bright area in the middle. This means the visual field is constricted, or what some people will call tunnel vision. So it's like, you can only see this much.
So Doc, is there anything that we need to avoid?
For glaucoma, in earlier years, some doctors would actually say you can't drink coffee, you can't drink tea or certain foods. Okay, but now because of very effective medications, we don't usually limit anymore in terms of the diet of the patient, unless the patient is diabetic. Okay, if the patient is diabetic, then of course whatever should be avoided for diabetic patients will hold true for glaucoma, especially because diabetic patients can develop a special type of glaucoma called neovascular glaucoma. So maybe that's one. You can think of that as a risk factor if your patient is diabetic. The other, probably in terms of lifestyle, is if you do have a family history of angle closure glaucoma, then you avoid staying in a dark room for a long time. Because if you stay in a dark room for a long time, for example, you're going to watch 2 movies, right, one after another. When you stay in a dark room, your pupils dilate. If your pupils dilate, this increases your risk of developing an attack of angle closure glaucoma, the painful type of glaucoma. Just recently, I had a patient who developed an attack after she watched a movie. Yeah, so we had to do emergency laser and later surgery. But it's not that common. The more common type is the open angle type, for which actually we don't have too much, not too many risk factors. That's why we still, again, recommend just a basic eye exam at 60.
What about reading a book too close to your eyes?
Close? No, yeah, I don't think so. Yeah, there's no direct relationship. Usually, parents will complain about that for their kids holding it too close, but we don't see any direct relationship of that with glaucoma.
Or maybe not enough lighting.
You'll probably get eye strain, but not likely glaucoma.
So aside from diabetes, are there any other diseases that can increase the chance of getting glaucoma?
Aside from diabetes, we could probably think of one of the more common ones would be if we encounter patients who are on chronic steroids. So bodybuilders. Well, yes, if the bodybuilders are taking steroids, or if you have a patient with connective tissue disease like SLE, that's lupus, or rheumatoid arthritis, or kidney diseases like nephrotic syndrome, these patients tend to need constant or prolonged treatment with steroids like prednisone, dexamethasone. Sometimes some patients just self-medicate if they have arthritis on their knee. Some patients will just go to the pharmacy and buy Desilone. Okay, I get patients like that who they just self-medicate. So if they keep using the oral steroids for like months or a year, then the pressure in their eye can increase and they may develop glaucoma. We call it steroid-induced glaucoma. The other thing I can think of that we also see commonly is if the elderly patient, for example, has a cataract and has neglected it for a long time. So if the cataract becomes too large, it can, let's look at this, okay? If this is the eye and the cataract is here, if you leave this too long without surgery, it can become very, very fat, it can become very big, and it will push the iris forward. This is the brown one. So if you push the iris forward, the drainage system there in the corner can be blocked. So they also develop glaucoma. So that's it. In steroids, neglected cataracts. In babies, if the baby has retinopathy of prematurity, this can also lead to a special type of glaucoma. Okay, so glaucoma is a big family. Think of it as a big family, different subtypes.
Many cousins.
Many cousins, yes, that's right. Many cousins.
Thank you, Doc.
You're welcome.
So when we come back, we will discuss how to combat glaucoma. So stay in your seats. Health Watch will return. Can blindness resulting from glaucoma still be reversed?
Unfortunately not.
You're still tuned in on Health Watch, and we've already discussed how a person can acquire glaucoma. So, Doc, can blindness resulting from glaucoma still be reversed?
Unfortunately not. Okay, it's that's the sad thing about glaucoma. Okay, so unlike cataracts, in which you can actually reverse the blindness just by surgery, in glaucoma you can only save whatever vision the patient has left. Okay, so if a patient comes in to my clinic and can no longer see anything, not even light, and if he does have glaucoma and glaucoma is the reason for that blindness, then there's nothing we can do about it. We can just perhaps prevent pain, keep the patient comfortable, because uncontrolled glaucoma your patient will develop very painful red eyes. That's why the key is still prevention. Okay, so from the ophthalmology standpoint, that's why we still recommend prevention, early detection. Early detection is really the key to preventing blindness, because blindness from glaucoma is very preventable. The question is if you can find it in time. If you can find it in time, then there are a lot of treatment options available. The first line for open angle type is usually medication. If they can be controlled with eye drops, medication is just eye drops. It can be as simple as one type of eye drop once a day. So as long as the patient is willing to buy these eye drops and can be relied upon to put the eye drops every day and not forget, then it can be just that. Then you can maintain his vision for the rest of his life. The question is if the patient stops responding to the medication. For example, you add another one and the pressure is still high, and then you add another one, and then the patient is already on 4 drops. Okay, wala na siyang ginagawa sa buhay na except to watch the clock and remember what time he has to put the drops. So that's a very difficult life for the patient. So in those cases, we may suggest surgery, glaucoma surgery, but you still have to explain to the patient that the vision will not improve. You just want to maintain the vision he has without his having to put 4 kinds of drops, 3, 4, or 5 times a day. For the angle closure type, then the main treatment for that is laser. We have it available here also in Doctor's Hospital. So if you catch it early enough, the laser can already control the glaucoma.
All right, thank you, Doc. So do you have any reminders for us and also the viewers?
Oh yes, thank you for asking. Actually, what we really want to tell people, our Filipino people, is when you reach 60, it's really good to have at least a baseline eye exam. Okay, visit your nearest ophthalmologist and have an eye checkup just to screen for glaucoma. And also, especially if you have a first-degree family relative, for example, mom, dad, sibling with glaucoma, then you also need to have an eye checkup for glaucoma, even if you're not 60 yet. Prevention is still the best way to prevent blindness from glaucoma. Early detection and prevention.
So you don't have to wait until you're 60?
yeah, you don't really have to wait. Although at 60, we highly recommend because this is the age in which we expect to find more a higher incidence of glaucoma as you get older.
All right, thank you so much, Doc. Thank you for enlightening us about glaucoma. It's always a pleasure to have you with us.
Thank you. It's always my pleasure to be here with you too.
Glaucoma is indeed a deceiving eye disease that we should all watch out for. It doesn't hurt to have your eye checkups whenever you feel like you have vision problems. Nothing beats prevention and early detection of any disease. So if you have any health concerns that you want us to discuss on our next episode, just drop us a message on our Facebook account. And again, this has been Kristianne, your host, and thank you for watching Health Watch, only here on the Amazing Planet channel.